Well, good morning, everyone, and welcome to the Selkirk Regional Health Centre. I am Dr. Alan Lagimodiere, MLA for Selkirk and St. Clements. And first, I would like to take a moment to acknowledge that we are on Treaty 1 territory, the traditional territory of the Anishinaabe, the Cree, the Oji-Cree, the Dakota, and the Dene people of Manitoba, and also the homeland of the Métis Nation. So, thank you all for joining us here today, and I would like to remind everybody about the importance of social distancing in any gathering we're in Manitoba right now. So, with this announcement today, I'd like to acknowledge a few of our special people that are here today. Mr. Glenn West, he is the board chair of our IERHA. I don't know if any other board members have joined us here today, Glenn? No? Okay. Okay. We also have Rebecca Clifton, Executive Director of the Paramedics Association of Manitoba. And I don't know if we have any other dignitaries in the audience. No? So to make today's announcement, I would like to invite my colleague, Mr. Cameron Friesen, the Minister of Health, Seniors and Active Living, to make the announcement.
Thank you, Dr. Al. Good morning, everyone. Great to be here. Rebecca, great to have you here. Glenn, nice to have you here as well today, and congratulations to you on your new role as chair. Not new to the board, but relatively new to that role. I know that you'll provide excellent leadership there. It's great to be in the city of Selkirk this morning. Bonjour, and merci à tous d'être venu ici aujourd'hui. Happy to be here with my colleague, Al Lagimodiere, the MLA for Selkirk. Our government, as you know, is committed to ensuring high-quality emergency medical services are available to Manitobans throughout the province. Notre gouvernement s'est engagé pour assurer que les services médicaux d'urgence de haute qualité soient offerts aux Manitobans partout dans la province. We've shown that commitment by recent investments and initiatives for medical emergency services in Manitoba. Some of the things we've done. We've purchased 65 new ambulance units. That refreshes the province's overall fleet by approximately 1/3. We have been steadily reducing ambulance fees that were among the highest in Canada before we came to office, and we have shrunk those by 50%. Those fees are now $250, not the $500 that they were previously. Making emergency care more affordable and more accessible is incredibly important. We have added, importantly, 150 new full-time equivalent paramedic positions since 2016. That includes 35 new positions added in this past year. And of course, we are working to declare paramedicine as a self-regulated profession in Manitoba, and that work is underway. Redevelopment of the Emergency Medical Services Program remains an integral part of establishing a more responsive, more reliable, more sustainable, professional EMS service. And that is why we're happy to be here today in the city of Selkirk to announce a new EMS facility to be built right here in Selkirk. It will assist in those efforts to make a strong and stable EMS service here in Interlake Eastern Regional Health Authority. Il nous aidera dans nos efforts pour construire un système de EMS plus réactif, fiable et durable dans l'ensemble de la région de santé entre les lacs et de l'Est. The new EMS station here will be a $4.2 million investment. It is a 7,500 square foot station. Three-way builders from Steinbach, Manitoba will complete construction of this building. It will have a 6-bay capacity, an office building. It will include modern offices, crew quarters, and space for paramedic training. It acts essentially as an operational home for the paramedics who are stationed in this area. Throughout their shifts, paramedics are repositioned, so they're not here all the time, but they're using a globally recognized flexible dispatch model that allows computer modeling and predictive deployment to ensure that they're in the right place to be able to respond well across the region. That helps us to keep wait times down. This EMS station builds on our government's commitment to enact recommendations that were made in that 2013 EMS system review report. Now, I'm going to hint today and say this won't be the only such facility, but you're going to have to wait a little bit longer to hear about other ones, maybe not too long to hear about other ones on the way. We are committed to getting better health care sooner for all Manitobans. We are committed to making good investments in the area of EMS. Nous sommes déterminés à nous assurer que la façon dont les Manitobans ont accès et recevoir des soins de santé s'adapte et s'améliore constamment. Thank you very much, and I will now give the podium back to Dr. Al.
Well, thank you, Minister Friesen. At this time, I'd like to call on Mr. Ron Janzen, who is also our current acting CEO of our IERHA. Mr. Janzen.
Thank you, Alan Lagimodiere, and welcome, Minister Friesen. We're so glad you could come to our region today and to make this important announcement, to celebrate with us one more step closer to the end of a very significant journey of major healthcare infrastructure here in Selkirk. This process actually began a lot of years ago with the envisioning of a new health center here in Selkirk, and replacing this facility that we're launching this announcement from today, because the ambulance station is integrated with the old hospital. Of course, there had to be plans put in place for how we would take care of that infrastructure in the future. And today marks the start of that infrastructure coming into being. So we're so pleased. 3 years ago and a few months, we moved into the new hospital, which has been incredible for us and for the region in total. It is a regional health center, and in that sense, this is also a regional emergency ambulance superstation. And something that people say about our healthcare system, and you know, people have lots to say about our healthcare system, but something that you almost always hear in any context is that it's there for you when you need it. And when you really need it is in emergency circumstances. And this type of infrastructure is going to assure that our region continues to have emergency response when you need emergency response. And a station like this, with the 6-bay vehicle storage and the training center, really allows us to have the capacity to continue that into the future. Some 3,500 transports a year, both primary and inter-facility, happen out of this particular site, and that is very critical infrastructure and very critical support to people in times when their lives are depending on it. And we're so grateful for that investment by the province. I want to say today also thanks to the province for letting us stay here in the old hospital. It's now, like I mentioned, 3+ years since we occupied the new one. And it's not without cost to stay and continue using the old hospital for things like the ambulance bay, for a number of offices, for incineration purposes that are still being operated, and for a community audiology program. This building continues to serve a number of important needs. It is slated for decommissioning, but we have needed time to bridge to that point, and that support has been appreciated as well. So thank you very much, and thank you for coming out today.
Thank you, Ron. I would now like to introduce Louise Aller, Director of Emergency Services for Interlake Eastern Region for Shared Health.
Thank you, Alan. I am very pleased to be alongside the Minister and all of you here today on this occasion. The construction of a new EMS station will provide significant upgrades for Interlake Eastern RHA paramedics, support staff, education staff, and administration staff. The new station will provide staff with a larger, more modern space filled with all the amenities that paramedics do need day to day. It will also help improve workflows and provide a positive environment for education and training. Ultimately, the new station will allow us to build upon the quality of care of people living in the Interlake Eastern Regional Health Authority. Emergency response services and paramedicine play an important role in Manitobans' healthcare system, and this new station will be no exception, as this is one of the largest stations within the region and the province. Also one of the busiest. From the moment someone calls 911, emergency response services are mobilized to coordinate a potentially life-saving response of emergency care in a timely fashion. While this new station will act as an operational home base, most paramedics working out of the station will only be here at the beginning and at the end of their shift. In between those hours, paramedics and ambulances will travel are repositioned using global recognized flexible dispatch system that uses computer modeling and predictive deployment. This essentially creates a zone coverage for the entire Interlake Eastern region, ensuring that there's no matter where a call is coming from, paramedics are in the right spot to provide emergency response services in a timely fashion. The new station reflects a commitment made by the support these valuable life-saving services for Manitobans. Better facilities, better amenities for frontline administration and leadership staff enable them to provide the best care possible. On behalf of Shared Health, we are very appreciative for the investment and look forward to its grand opening. Can't wait.
Thank you, Louise. And this concludes our formal portion of our program today. Minister Friesen, Ron, and Louise will now take questions from the media.
Minister Friesen, we've heard about an outbreak at a school in Riverviews Transformers. They are having to shift some of the classes to online remote learning. And I know we were told to expect cases in school, but we're 1 week in, we're already seeing several. What is the province doing to help the school division and to help contain the spread?
Well, we always knew that there would be cases in schools. We can't be fooled. We know that as we start up schools, which is very, very important, we're going to see that intermingling. A lot of work, of course, has been done by system leaders, senior leadership teams and superintendents and their staff, school division staff in schools themselves. A lot of effort has been taken to communicate with care to parents about what this is going to look like. So I don't think that, certainly we don't want to downplay whenever there are cases. It's always serious, but this is why we plan. So contingency plans are in place. Public Health has done the contact tracing. They worked very hard yesterday to notify parents, to identify the cohorts where system leaders felt there needed to be care taken. So I would say we should not be alarmed to see students sent home out of an abundance of caution. Instead, we should be encouraged to know that the system is working.
There's been long lineups at some of the testing centers. As school returns and as fall arrives, it seems more people are going to get tested. Will the province be opening more testing centers or expanding their hours so that people are not turned away, as we've seen?
Yeah, it's a good question, and even just outside the doors here and down the street, there's another testing center here in Interlake Eastern Health Authority, and people are there. And of course, at this point in time, Dr. Brent Roosen has been clear that we're not encouraging people to go for asymptomatic testing. We need to retain the capacity in our system for those who need it, those who need to have that test taken. However, to your point, yes, this is an area of personal importance to me as the minister. We are continuously looking to see how it's going out there. What are the lineups? Is the capacity sufficient for the demand? Do we have flex capacity? What happens in a second wave? We're doing this both in respect of screening sites and in respect of our ability to return the results of tests quickly and promptly, either positive or negative. So I can tell you that as we go along through the next couple of weeks, there will be additional reviews undertaken to assess our capacity and to assess the need for additional investment there. But at this point in time, anecdotally, we continue to hear back from the regions who have this responsibility that they're generally keeping an eye on the level of demand and the level of service.
But are you committing to open more centres as fall arrives and flu season hits?
If the evidence points in that direction, if we need them, they'll be there. Just for example, let me speak briefly about Brandon. So last week in Brandon, as we saw the case rate start to move down, there was a decision by the leadership of Prairie Mountain Health to decommission one outdoor screening site, a drive-through site, but then they immediately reinforced resources at the indoor site. And so we moved workforce, we extended hours, we brought other resources there. So Manitobans shouldn't think that somehow we're curtailing those services. We're keeping a close eye on them.
Wouldn't it make sense to do so preemptively rather than wait until it's necessary, in your opinion, to open these additional testing sites? Because if you go back to March or April, we had far more opportunity to get tested. Now there's probably more people who are interested or eligible to get tested, but there's fewer sites available.
Well, we are doing a lot of advanced planning. You will even note that even into July, there were considerable efforts made to extend services, even while people were saying, well, what's the problem? The numbers are dropping. But we recognize that we were by no means out of the woods. So I would say to Manitobans, you can have a great deal of confidence that system leaders in the regions are paying careful attention to this. No one wants to be caught unawares. And that is why we are addressing this. We're really assessing the degree to which we have capacity, the degree to which we can stand up new capacity, and the speed with which we could marshal those additional resources. This is exactly why we also issued that RFP to canvass more, even for things like the contact tracing. All of that is part of that coordinated effort to say, sure, the numbers may support where we are right now, but will we have that ability in a break glass scenario to be able to do more? And that's the answer we have to be able to make in the affirmative.
Just to go back to the school story, I know that there's been contact tracing for the students. I'm wondering for staff, what's the precaution for staff? Because obviously they have contact with other staff, they have contact with people in the hallway. How does that work? Because we haven't really heard anything about how staff and janitorial staff, any sort of staff, are supposed to deal with this.
So I've asked those questions as well, and I understand from Dr. Rusin that that is the responsibility of public health, that when they do that assessment, they see a case either with symptoms or asymptomatic, they conduct that very rigorous examination of the conditions, and they look at all those considerations, like you said. Who's had contact with whom? Not just in a classroom, in a hallway, in a staff room, janitorial, custodial staff. And so on the basis of those things, it's their determination who was at risk and who gets sent home. So I heard Dr. Rusin say this earlier. I'll repeat it again today. Manitobans need to have confidence that if they are being phoned by public health this week, if there are parents who have been contacted and said, your child was in this cohort and they should now be at home and isolate for this period of time, they can have confidence that that investigation has been done. If you haven't got that phone call, it's safe to go to school. Thanks everyone for coming.